I think a lot of people recognise that One Health now is about the link between people, animals, plants and the environment. What really got me into it was that realisation that when we look at some of the big challenges that we're facing now in medicine, veterinary medicine, environmental health, none of us can achieve it on our own. My dad's been a huge inspiration in the early part of my science career. During that time, I've spent time in general practice, I've spent time in a research laboratory, I've spent time in startup and spin-out companies, I've spent time working for government. So this is the School of Biological Sciences at Queen's University here in Belfast, and this is where I am now based.
It's really exciting that we have a winner here. It enriches our environment, it helps us to further build our reputation in the whole area of food security and One Health. So it will add to our research, to our education, and just the whole environment in around our researchers, our students and our staff, and our many partners that we work with locally and globally.
So when we set up the UK One Health Coordination Group, we brought together people representing the human medical profession. There was vets, so the British Veterinary Association, British Veterinary Nursing Association, then the environmental aspect. So we brought people from the National Trust and from the Wildlife Trusts into that as well. Can anybody remember what One Health is? As I've increased my interest around One Health and sustainability, I've been able to use those opportunities for going into schools, and they're very familiar with some of the aspects of singing happy birthday twice to washing their hands. But taking that a step further and helping them to understand that bacteria and viruses and parasites can come from people, animals, plants and their shared environment. I've been involved with Ripple Effect for about 15 years now, so helping communities and families in developing parts of sub-Saharan Africa to lift themselves out of poverty. And it's very much about One Health in action. It's about people, animals, the environment. My family were there to support me in the early years, and a lot of colleagues then who have supported my drive around One Health and sustainability over the last number of years. It's very much taken as a recognition of where the UK and Ireland is in the One Health space. I think that there's some fantastic things that we can continue to do going forwards using that One Health approach.